Welcome to Soul Wellness with Kristen, where we get into the nitty-gritty of various holistic modalities and explore exactly how they help you heal. I'm your host, Kristen, and I invite you to join me on this enlightening expedition where we explore the connection between mind, body, and spirit. In each episode, we'll talk in depth with holistic providers, medical professionals, therapists, and healers. Our goal is to empower you with knowledge, inspire you with stories of resilience, and provide practical tools that you can integrate into your daily life. So, find a comfortable space and join us as we explore the multifaceted world of holistic wellness. Get ready to learn how to improve every aspect of your life and simply feel good. The adventure begins now. Thank you for joining us. Today I have Dr. Jessica Watson with me, and she's an acupuncturist and a doctor of ancient Chinese medicine. She's also a tenant here at Soul Wellness, so welcome.
Thank you for having me.
I'm excited. I hear this is your first podcast.
It is my first one.
I really can't wait to talk about all the things that you do because I've heard that you incorporate a few different modalities into your sessions with patients. Let's start off. How did you get into this?
Sure. So there were kind of a few different things that intertwined and led me to this medicine. One just being that I grew up just kind of being a more sensitive individual. I went through my own periods of depression and social anxiety in high school, and I knew I wanted to get into the healing arts in some capacity. And when I was in high school, kind of entering college, the only vessel I knew for that was kind of the modern mainstream medicine. And so I thought I wanted to be an occupational therapist because, for one, I would be helping people, but two, I could kind of keep some creativity within that field. And then when I was in college, I witnessed my mother navigate a breast cancer journey with kind of overwhelm and fatigue and stress. And there was miscommunication between her nurses, which resulted into infections. And there were just some things about the system that I perceived to be a little off. So from an outside perspective, I imagined if I was in her position dealing with something chronic, that I would want to be in a different environment that seemed a little bit more healing and warm and personalized.
That makes perfect sense. Tell me what exactly ancient Chinese medicine is.
Sure. So ancient Chinese medicine has been alive for over 2,000 years, and it's been in use in China for over 2,000 years. And it's an ancient indigenous holistic medical system, meaning it zooms out to the whole and perceives the interrelationships between different functioning facets and how these facets interact with and affect each other. So there is a system behind it through which we perceive phenomena, and there are different gestures of expression and how these gestures affect the whole. For example, we often look at the 12 organ networks, and the heart is the center of the organ networks. And the heart has this gesture of opening and connecting everything in our body from a cellular level to manifesting in our outer world, in our symptom picture. So we're viewing these interrelationships, say between all the organ networks, the lung, the kidney, the liver, the heart, and we're seeing how they are interworking together. So as practitioners, we're constantly perceiving these relationships between things and how those manifest at the surface. So it's based on the notion that the subtle rules the dense. We are eliciting subtle changes, subtle pivots of directionality in the body that manifest both internally and externally, and physically, mentally, emotionally. And within Chinese medicine, you can utilize many different modalities. You can utilize acupuncture, dietary changes. You can utilize Chinese herbal medicine. You can pretty much apply anything to ancient Chinese medicine itself.
And it can be used to treat anything.
I mean, technically, yeah. Because
it's the relationship of the flow and the energy between your organ systems and all of that.
Yeah.
Because when there is a blockage or something isn't flowing, that's when the physical symptom appears. Is that what happens?
Yeah.
And that's when most people run to their doctor and want a pill to fix that.
Yeah.
And not look at why.
Something with intention. And sometimes it's not about why, but it's just a matter of, this wants attention. Let's check this out. Yeah, let's see what's there.
Yeah.
And acupuncture is how we're checking out what's there. When we're putting a needle into the body, we're making that contact within the person of that thing that wants attention.
So that thing that wants attention is now like, wow, you're paying attention to me. I have a needle in me and I'm going to start flowing. There's energy here.
Yeah, we're making these subtle little interactions in the body. Mm-hmm.
That's interesting. And if someone hasn't ever had acupuncture, they should probably know that the needles that you use are almost like a hair strand.
They're tiny. They are way smaller than your typical shot needles you might get.
I'm a complete needle phobe, and I've had acupuncture many, many times. But I'll tell you, when they zing you, that is a very unusual sensation.
Yeah. So
what is that about when you get the zing up your arm? Like if you have a needle put in and you get this zing of energy up your arm.
Sure. So we call that Dutchy, the chi sensation.
Okay.
And that's pretty much the sensation that your body's eliciting when it's making contact with something. So that can feel like this expansion of energy. You might literally feel a stream running from one area of your body to another. You might feel really relaxed all of a sudden, or you might get this spark of energy. There's so many different things you could feel when that needle inserts your body.
And it's basically that area that needed attention is getting it.
Exactly. Yeah. And all those sensations are normal.
Interesting. Okay. So tell me about your education, because I know that it's extensive for these type of modalities that you work with. So tell me about that.
Sure. Yes. So I got my undergrad in health sciences. Thinking I wanted to be an occupational therapist, I knew that I would be doing a master's education or continued education in some sense.
Okay.
And then my final undergrad, I was learning about alternative healing modalities and healing medicines, which I didn't even know existed. And I stumbled upon an introduction book to Chinese medicine called Between Heaven and Earth. And within reading the first 5 pages, I felt a deep resonance with how the theory behind Chinese medicine speaks to these gestures in nature that also express themselves in human beings. Like there is a connection that felt really just validating to me and authentic. And so I decided to pursue it. So I looked into it. And just from my own research, I stumbled upon different schools of acupuncture, which acupuncture is the most well-known modality within Chinese medicine, usually, typically in the United States. And there were 2 schools that I really liked how they presented the medicine, not just as this technical thing. These 2 schools presented their curriculum as more than technical, but that it seemed really also in line with the root of the medicine and the spirit aspect.
They just felt good to you.
Yeah, it felt right. So I ended up going to the National University of Natural Medicine. In between that, I took 2 years to kind of explore and travel and get out my little inner hippie experience.
Probably smart.
Yeah.
Everybody should do that, but we just typically don't.
Yeah. And within that time, I also met someone. So I was staying at this kind of community in Panama, and I met someone who was a practitioner of Chinese medicine and Ayurveda. And he kind of validated that, yes, you should do this.
Yeah.
And yeah, so I didn't really know what I was jumping into, to be quite honest. I just knew that I loved the theory behind this. Mm-hmm. And I was like, whoa, there's a school that's set up to teach this. And I had never had acupuncture. I had never tried Chinese herbs at all. And to be quite honest, I think it was good that I was a little naive. I didn't know what the program that I was pursuing entailed, and that we would be learning how to read classical Chinese characters, classical Hanzi characters. I'm so grateful for that now. So we learned how to read ancient Chinese characters so that we could more deeply interpret the classical texts behind Chinese medicine.
Wow. How many years?
So it was 5 years.
5 years in Oregon.
Yeah. And one of the unique things about where I went to school is we had what was called a traditional mentorship tutorial. So we were exposed to a bunch of different practitioners' styles, because within Chinese medicine and within acupuncture, there's actually so many different ways to practice. And so we would choose whoever's style we resonated with, and then we would learn from them for a year in their particular style as this mentorship. And so I did that with both acupuncture and herbal medicine.
Was that easy for you to choose? Was it very obvious when you were working with these practitioners, like, ooh, I want to work with that one?
Yes, yeah. I definitely took more than one tutorial because I was so curious and interested and fascinated. But there were certain ones that I definitely resonated with more than others.
Yeah, that's fantastic. You obviously are meant to do this. I mean, it shows your curiosity and your passion for it show very much so.
Thank you.
And then was there anything after that? Or you were ready to practice at that point?
So after that, I joined one of my herbal mentors. His name's Heiner Fruhoff, on a retreat in China. And he took us to China to meet some of his mentors of both Qigong and herbalism and some of his colleagues. And I was able to kind of see the birthplace of this medicine and where it came from. And then after that, I passed my board exams and then began practicing.
Wow.
Yeah.
Well, I have to say, I've heard about you. I've heard other people say that you are more than just an acupuncturist. Yes, you can go to her and have acupuncture, but there's far more to you than just that. You are somewhat intuitive. There's an energy component to you. You're not just sticking needles in someone and letting them hang out for an hour or so. There's more to it. So talk to me about that too.
Sure, yes. So what we're really looking at as practitioners of this medicine is we're continuously perceiving different gestures and how they are coming to the surface in individuals and how they present as either physical, mental, emotional, all of the above manifestations.
So a gesture is kind of like a symptom.
It is,
okay.
Yes.
Okay.
So there's 12 organ networks that we're looking at within Chinese medicine. The heart is at the center of the organ networks. And those speak to different patterns that we are moving forward in our life with. And what I'm doing is I'm trying to piece together the symptoms you're telling me, but then also I'm looking at your tongue and I'm feeling your pulse. So in Chinese medicine, there's actually 12 pulse positions and there's different depths beneath that we're feeling for. And we're feeling for these impulses and these different expressions. And that tells us something about the inner dynamic going on at once. So what I'm doing is I'm taking all of that information. I'm always taking some and leaving some because there's always this room for things to just present themselves to me, for me not to put things into a box, but to keep things dynamic as they are, as is life. So whatever's coming up, I'm getting an idea, and then what I'm doing is I'm going to feel the meridian network and feel the different meridians and see where there seems to be a blockage or an area that wants attention.
So if someone comes to you with a physical problem, an issue, a symptom, and you're working on them, do you have the patient actually explore some emotional things as well? Are you asking questions like, so have you been feeling such and such? Or do you see what I'm saying?
Sure,
to help them kind of connect the two?
So I'm not a counselor, so that kind of is outside of my domain, but I will often want to know, emotionally what's going on in someone's life.
Happening.
And one of the cool things that I want to continue to get into as I continue this medicine is there's dream work within this field where you can take symbols that came up in someone's dreams and you can tie them to symbols of Chinese medicine and see if there's anything there. So even as I'm working, there's always a component in healing. So I see healing practitioners as guides and the modalities as vessels. There's always a component, and we bring up these stimuluses within people. We help people make contact with certain facets. But there's always a part of the patient's awareness that is required in their own healing. And this happens naturally in most people. The only time that maybe it's not so helpful is if someone gets fixated on the modality itself as something outside of them that is the answer. Because the transformation's always happening within us, and we're just guiding things to make contact.
In other words, if they're coming to you for acupuncture thinking this is going to fix me and I don't have to self-reflect, I'm just going to show up and have acupuncture and be fixed, it's not going to work. Like you're going to have to do some inward reflection on yourself to let this work. Is that what you're kind of saying?
It will move things, acupuncture and Chinese herbalism. But I think if that's the question that someone's looking for, the thing, I think in general healing, that's not always the question. And I mean, acupuncture and Chinese medicine, they are great vessels for making those interactions themselves. But I think the deeper that someone can contact and bring some kind of awareness to patterns is only going to deepen the medicine for them.
Right.
Does that make sense?
And probably accelerate their healing.
Yeah, I would think so. But just realizing that the change is happening within the person. It's happening within you. That's where the change is happening. So that's where the focus, I think, is most helpful. And using acupuncture, using Chinese medicine, it is a beautiful modality, in my opinion. But knowing that it's a modality.
Yeah. But you can treat, or you see patients that have any kind of ailment.
Definitely. Mm-hmm.
Yeah.
So whether we're starting with something physical, quite literally a headache, or irritation, like I'm always getting irritated, I don't know what's going on, or, I'm feeling anxious and depressed. Any of those are entry points that we can work with.
Okay.
And Chinese medicine can help to move things. And I mean, Chinese medicine and Chinese herbal medicine specifically, why I love it is because we are using this kind of synergy, and we're looking at this picture of what's going on in the body to kind of open space for this internal alchemy to happen. Mm-hmm. Yeah.
Talk to me about the herbal facet. I know
Sure.
you like herbal medicine, you recommend herbs, and you give your patients herbs, correct?
Correct.
Yeah.
Yeah.
So talk to me about that.
So Chinese herbal medicine, that's a modality that we use within the framework of Chinese medicine to send a gentle and subtle stimulus to different organ networks, which helps the organ networks to realign with their innate gestures. And each time we take an herbal formula, we're sending this stimulus again and again until the body begins to pick it up. So for example, say that I notice in someone the lung is not descending at its highest function. So in the body, the lung's gesture is to descend. It descends things. So one is depressed, one has stagnation in their diaphragm, they're urinating frequently, their water metabolism is off. So I prescribe an herbal formula that helps the lung to return to its function of descending. And then these symptoms will start to move and kind of clear up.
I see.
Yeah.
That's fascinating.
Yeah.
So have you just seen majorly profound things doing this type of medicine? Have you seen people just bounce back?
It's been awesome, even since I was in school. And that's kind of what in school was so amazing, because I would see people come in with ringing in their ears, and then they would walk out with it much lessened. And then I saw herbal medicine really do some profound things. And yeah.
Incredible.
Yeah.
So what if somebody has like a cancer diagnosis or something?
Sure.
And they decide that they don't really want to go through chemo and all of these really harsh treatments. Can you treat somebody? Can you send them on a different path?
Sure. So we are not allowed to say we can treat cancer or anything with a Western name. But I would just say if I or someone I loved did have what we call in Western medicine cancer,
or disease,
which could be, in Chinese medicine we call that an excess of phlegm.
Yes.
Then one of the first places I would look for support would be to someone who practices Chinese medicine, who practices herbal medicine as well as acupuncture. Yeah.
Okay. And then what about energy work?
Sure. So one of my favorite teachers of mine in the field, his name is Brant Stickley, he always told us the subtle rules the dense. That's how Chinese medicine works. We're moving from the subtle energy field into the physical body. And say we're comparing it to, chakras, which are a little bit more
expanded, bigger.
Yeah, which are a little bit more expansive. The meridian system is much closer to the body, to the physical body. It's much more involved in the inner workings of things, the day-to-day structure, patterns.
Okay.
So it's just closer
Okay.
to the physical beingness of things. And it is energetic. But it's also material. It's also literal. It's also, we'll see literal physical changes. So that's what I love about it, is because it intertwines and it validates both aspects of life. That there is spirit, quite literally spirit means something's inspirited, And there is also this physical manifestation, this literal aspect that we're working with at once. Yeah.
Tell me what a normal first appointment looks like with you. Like, how long is this appointment? What are you doing? What kind of things are you asking? I'm curious about that.
Sure. So typically on the first appointment, we do an intake. I find out what someone wants to work on. Where are you in this healing journey? Are we working on constipation? Are we working on a deep life transition? Like, what are we doing? And then we do an intake so I can get an idea of what's going on and what we call someone's chi dynamic. And then I do a tongue analysis and I feel the pulse for quite a bit of time, maybe 5 to 10 minutes, to fill in any gaps and give me an idea of where to start. So I might start immediately with a few points and have an idea from the get-go, and then I will energetically palpate the meridians themselves to see if there's any blockages or areas that are seeking attention. And I'll usually stay with the patient for a good bit of time and then maybe leave them to rest for 10 to 15 minutes to integrate the needles, but I'm usually with them for the majority of the time, at least on the first visit. And a lot of the time, I also integrate craniosacral therapy.
Nice.
Holds on the head, on the feet. And I use this non-insertive tool called the Taishin, which works with the outermost layer of chi called the Wei Chi. And I use that quite often. And I even have an option for those who don't want to try needles from the get-go. It's called meridian therapy.
Okay.
And we're working with the meridian system using other modalities than just needles. And then it's really important for me to connect people with what we're working on because I'm the vessel and they're the ones undergoing the change. So I'll always send a follow-up email about what we worked on from a Chinese medicine perspective. And I'll usually ask the patient if they're interested in herbs. And if so, I'll prescribe them an herbal formula through Golden Needle, which is a third party that will ship it directly to their house.
Okay. And you were telling me before we hit record that the herbs are really, it's a supplement to use in between appointments with you. It's kind of support and it helps in between appointments, basically.
Yeah, it's something that the patient can do themselves when they're at home. And it's almost like from the inside out, they're giving themselves an acupuncture treatment every time that they take that formula.
Nice.
Because it's stimulating things in a similar way. So it differs for every patient, but we'll always talk about timelines of, okay, what are we working on? What are you looking to do? Whether it's every 2 weeks we see each other, every month, which is the most common for me, is seeing each other once a month, or a few times a year. And in between that, what herbal medicine can do and other lifestyle suggestions or dietary suggestions is it can help the patient to continue moving things while they're away from the treatment room.
How long is a normal appointment with you?
So the first one's 75 minutes, but normally it's 60 minutes.
Okay. Very good. And it sounds like there's just all kinds of things that you have in your toolbox. That's amazing because I know when I've gone to acupuncture in the past, that's it. You're getting some needles in you and then you're going to sit for 30 to 45 minutes or maybe even an hour. But there's no craniosacral, there's no energy, there's no intuition, there's no, herbal medicine as well. So that's really cool that you offer so many things.
Yeah, I really have my mentors to thank for that. And I really did love my education. And I think that we were always told to follow what resonates, and we were always reminded that within the meridian system, there are so many modalities we can bring to it. So, yeah.
Your education is similar to what a Western medicine doctor is studying as well, because you're studying the entire body, correct?
We definitely do study the entire body, and I think what many people don't know about acupuncturists is that everyone, doctor or not, has to take 500 hours of Western modern medicine, and then we have to pass a Western medicine board exam to get licensed.
Wow.
And that's not just to say...
I didn't know that.
Yeah, and that's just to express that we can take these, reductionist medical understandings, these modern biomedical understandings, and apply them to a larger picture of what's going on.
That's fascinating. You've got 9 years of education.
Yeah, if you count undergrad.
I count undergrad.
Yeah.
That's impressive. That's really impressive. So tell me how acupuncture even works. If someone has never had acupuncture, tell us the elementary explanation of how acupuncture works.
Sure. So, from a Chinese medicine perspective, the meridians are kind of like rivers of communication that flow between different organ networks. And basically, what we're trying to do is we're trying to free those lines of communication. And one of my teachers says that there's one pathology flowing against. So, we're just trying to return the flow. From a biomedicine standpoint, acupuncture stimulates the central nervous system, the vagus nerve. It increases circulation and blood flow. It contacts nerve endings and opens neural pathways, releases serotonin, endorphins, and dopamine. So there's many ways of looking at it, and pretty much we are trying to restore circulation and flow, communicative flow between all aspects of someone's being.
So when something is wrong, there's a blockage. There's something isn't flowing.
Something isn't flowing, or it needs attention and it needs to be made contact with, and it has not been made contact with.
Okay.
Mm-hmm.
Because I'm just thinking, when you see an energy healer that might be working on your chakras or that kind of thing, they'll use the term congested, like the chakra is congested, or there's a blockage, or those kind of terms. It sounds almost familiar when you're talking about the meridians and things aren't flowing.
Sure, yeah. And also, so within Chinese medicine, we have different parameters. And one that we often use is excess and deficiency.
Okay.
So a deficiency would be somewhere that needs more energy, it needs more warmth and circulation, and then an excess would be somewhere that has a little bit of too much buildup in that area, and it needs to be released. So that's one way that we can look at it.
Okay. This is super fascinating. So tell everybody how to find you. What's the best way to find you if they want to reach out and maybe consult or have a first visit with you?
Sure. So you can go to my website, rootsofharmony.com. You can also find me on the Soul Wellness website, and you can directly call or text me or schedule online.
Okay.
There's that option. Yeah.
Okay. And all of your contact information is on your website?
Correct.
Rootsofharmony.com. Okay, perfect. That's awesome. I hope that lots of people reach out to you and find you, and especially those that are feeling hopeless, have seen too many doctors and need a different new perspective.
Thank you. I appreciate it.
Yeah, it was fun. We'll do this again, I'm sure.
Thank you for having me.
Thank you for joining us on another enriching episode of Soul Wellness with Kristen. We hope the insights shared today have resonated with you, inspiring a deeper connection to your own journey towards holistic well-being. If you enjoyed today's episode, we invite you to subscribe, share, and reach out. Your feedback fuels our mission to bring you meaningful content that educates, empowers, and uplifts. Remember, you are a vital part of this community, and together we're creating a ripple effect of positive change.